as well as a TEDx speaker. So we have a international speaker here, and also he has on his record an Young Excellent Star Award. Okay, wonderful. And he has performed the world's first laparoscopic management of uterine rupture. Wonderful. So may I just request Dr. Surakshit to go ahead with your talk. We are all waiting for you.
Perfect. All right. So thank you so much for the introduction. So my topic today is going to be on, my journey through cosmetic gynecology. I'd like to first thank Chandani for giving me this opportunity to be here and present here. The first part of this is that, I've been in cosmetic gynecology for close to around 7 years right now. So over the years, I've learned a lot of things. So I thought I can discuss a little bit about my journey and probably my observations so far. So my first desensitization to cosmetic gynecology was one of my patients came up to me and she said, "Doc, do you do LVB?" So you all hate it, right? When the patient comes to you and uses these abbreviations, same thing happened to me. But then again, I asked her, what exactly is LVB? She said, laser vaginal bleaching, doctor. So I was like, oh, okay. So I've done, hymenoplasties before, but it was the first time I actually heard something like, laser vaginal bleaching. So I told her, you know what, listen, let me go get myself trained in whatever you're talking about and then get back to you. So then I started doing my research, right? The first energy which I came across was the Thermiva. I think that is like pretty much for everybody in cosmetic gynecology. But the only problem with Therm, this RF energy, I really did not like the way we actually, delivered this energy. So I did a little bit more research and then I came across the CO2, the carbon dioxide laser. It had a robotic arm. There's a button and it does the work for you. So then I wondered, okay, how many more of these, wonderful equipments were there? So I went ahead, decided to do a couple of courses, decided to, attend a few conferences. And while researching all this, I found out this actually was nothing new. Like Dr. Tanuja was saying, no, it has been done in India, but also if you look at it, in several centuries, it was happening even in the Amazon era. So during those times, what they used to do, they used to take a heated stone, put it inside the vaginal canal for the same sake of rejuvenation. Okay, the Egyptians, what they had like a pessary. Okay, they used to put it inside the vagina, of course, for the prolapse at those days, 800 AD, right? And the Romans, they used to use heated speculum inside the vaginal canal for the same sake of rejuvenation. So what happened over the years is that the only type of energy what we use has changed, and also how we apply it also has changed, right? So when you look at the evolution of beauty over the years, it has pretty much taken a lot of changes, at least in women. No, previously in the 1950s and all, women a little bit more plumpier. That was considered as very sexually attractive. Nowadays, skinny women are considered more attractive, but you see the fundamentals are always the same. You're looking at smoothness, you're looking at symmetry, and you're looking at youthfulness. Okay, this is probably one of the reasons why we also put makeup, right? Because you all that whole airbrush kind of appearance. If you also dye our hair black and not white, because humans, we look at age for some reason like a disease. Okay, so we are always looking for this elixir of youth, right? So I really like this quote. Humans always find ways to address nature's inadequacies. That's how that's what happened for us even in IVF right now, isn't it? One second. Yeah. So now, if you're asking me why it is on the rise right now, okay, this is very important. We need to understand this because there's been 200% increase in women who are looking at sexual dysfunction and vulva procedures right now. And why do you think this is? It's only because of social media. Because what's popular in France is now popular in USA. What's popular in USA is popular in India as well. Another reason is that companies want you to buy their stuff. Okay, they have a very simple logic. They want you to feel less cool and less adequate, right? This is their strategy. For example, if you see in this ad, you have this woman over here who's actually modeling for a burger ad. Probably she would have never had a burger in the past 1 year, but this is how the media sells to you, and it wants you to aspire towards that. And this is never going to stop. So one thing I've also understood is that, we are a good 10 years behind USA in terms of training and expertise. No matter how many, cosmetic gynecologists are there in India, probably we have the highest number of cosmetic gynecologists in the world, but I'm sure we are definitely 10 years behind. Unfortunately, what's happening is most of the trainings here, they want you to believe that if you sell the commodities that the companies are offering to you, you can somehow become a cosmetic gynecologist. But it's actually far from that. Okay, you only become a glorified massage therapist. Okay, the more commodities the doctors are selling, in fact, the companies now also they're racing to become more cheaper. But the problem is, cheaper doesn't mean it's better. It's becoming less effective. Previously, over the past 4 5 years or 6 years back, there used to be a lot of backlash from doctors. They used to be like, why you're doing this cosmetic gynecology, why this, why that. So the companies and the doctors took a back seat. Now all these people who used to do the backlash before are no more there. They don't. Nowadays everyone is looking to learn more and more in cosmetic gynecology, and also the companies basically what they're doing is they're putting weapons in the hand of gynecologists. Okay, why? I'll tell you. It's easy. Yeah, I know it's easy to perform, but is it safe is a question we need to ask. I'll give you two analogies, right? If I go ahead and buy a Lamborghini, right, and if I crash it, is it the fault of the manufacturer? Okay, and also if I go ahead and buy a cheap electric car, and then I later realize when I was driving through it, it just suddenly burst during the long drive. Again, whose fault is it? Unfortunately, both the times it's our fault only. Okay, because what's happening over here is that we are buying machines at such a rate. We are also buying machines which have not been tested for long periods of time. Again, the fault comes back to us. We are just blindly believing what these company people are telling us. See, what you need to understand is less than 1% of all the doctors over here in India are completely trained in cosmetic gynecology, but more than 10% of them are training other gynecologists. Okay, and 60% of doctors, unfortunately, are in the risk of treating patients with this inadequate knowledge. Right. So buying technology does not make us cosmetic gynecologists. So let's not let these devices really dictate what we should and we should not do. Okay. So we are going, unfortunately, right now, the same route as what our dermatologist friends have done, creating unnecessary competition and undercutting costs. So all this, what is going to do? It's going to make a very bad rep for cosmetic gynecology, at least how I see it in the next few years. So I think we all right now should focus on really one thing, trying to push out as much good information as possible for the patients, because we are still not there. We are not at the point where this cosmetic gynecology is in everyone's head and they know what exactly is possible or what are the functional aspects we are treating and what are cosmetic aspects we are treating. Nobody knows that. So the information still has to go out there. Yes, doctors now are well informed, but it's also our job to inform the patients. Okay. So what I would say is that we should all focus on developing this thing called as the aesthetic sense. It's a very, very conscious effort. So whenever any surgical thing or whatever I'm talking about in the vulval area, I'm talking about the vulval harmony. Okay, you should be in a situation where you only want to go and do all your episiotomies. You should not want to give it to your residents at all. That kind of drive is required. In fact, I do most of my episiotomies. Okay, so you might be probably the top gynecologist, but if you don't have the aesthetic sense, no, you will probably never become an expert in cosmetic gynecology. You should always feel like I'm a resident, I'm learning something new, and this is like your first vaginectomy. That's the way you have to take it. Also, many people believe no, you can mix your regular, obstetric practice and your cosmetic gynecology practice. That will never work. Okay, these two are completely different sects of people, right? It cannot also be, integrated into your obs practice. Maybe Dr. Tanuja has a lot of, patients coming back to her, but it is something that these patients are actually really not interested in these procedures. How many of them really come back? Even though we call them back, we ask them, do you have issues? Do you have SUI? Not many people find that as a big concern, actually. So probably giving these packages might not really help them unless they're suffering from very, very severe SUI. And at that point, they will do their research online only. They're not going to come and ask you again. Okay. So what I'm saying is, and also another thing you need to understand is these are not procedures you can perform in your corporate hospitals. Okay. Because these patients are very, very secretive. They always like small, cozy places in a more relaxed environment. They don't want to be in these corporate hospitals. You also have to remember these are not patients, these are all clients. Okay, these people have found you or either on Google or Instagram, and unlike your obstetric patients who come to you because probably you're the best, these women visit you because you're very accessible to them. Okay, so they'll probably go to a few more places before she gets what she wants. Okay, so Also, you need to understand these are not patients who come to you from word of mouth, okay? Because they're not going to tell, you know what, I have SUI, I went to this doctor. No one is going to say that, or they'll be like, oh, I had vaginal laxity, so you have to go to the doctor. So word of mouth is never going to help. Okay, I mean, it's not going to be a part of this. It's all about how you give information online, and these patients are always going to come from there. So coming to surgical aspect, right? I would always say, you know what? There's always only surgery is always like an art. I think that Dr. Tanuja said it very beautifully. Surgery is like an art, and we are all like artists. But unfortunately, they can only be one Michelangelo. So if you look at it, Dr. Pelusi, he's been doing this for almost 20 years. Okay, 20 years he's in cosmetic gynecology. He still takes till today 120 minutes to do one labioplasty. Okay, I remember when I was training, there was one guy who trained along with me. What he said was, I can do the same in 2 minutes. Why do I need to do it for 120 minutes? Remember, if you do a procedure like this in 2 minutes and you ruin the patient's life, he will haunt you for the rest of your life. Okay, so please understand, know what your concerns are. Know something else I'm going to talk to you about very important after this. So, we'll come to that. Another very important observation I found is that Indian women have actually very small labias. Okay, that is why the actual need for labioplasty in India is actually very, 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 very less. So I'm telling you why this is important, because you have to understand where you need to target. Like whenever you're giving information, it has to be targeted to one particular region. So that is why most of these women who are actually coming down for these procedures also will be from the northeast region, because somehow genetically they are more predisposed to have these large labias. Okay, so, and also remember, when any of these people first search something on Google, you know what? They're going to find only a dermatologist. Okay, because these people have already flooded the whole internet with their thing. The problem with the dermatologist is that they are very shy. They don't like to go and examine the vagina. They'll just show the patient some of the photos. Here, you know what? These are the photos. I'll try to recreate it. That's exactly what they do. Sometimes the cosmetic surgeon is extremely skilled, but problem is, without examining or without talking to the patient, because they have so many other cases, right? They do like breast, they do, abdominoplasties, they do everything else, surgical, non-surgical. So they will not have the amount of time to actually spend with the patient to understand what they actually want. So sometimes the patient might want just a majora filling, but instead she would have got a minoroplasty. So these kinds of mistakes also happen. The good thing about us as gynecologists is that we are more comfortable in this vulval and vaginal examination. So I'm a big proponent for gynecologists doing these procedures rather than the dermats. Okay, and remember, all of these specialties, they require a certain number of cases and certain number of hours for us to become good at it. So this is also no different. But if you actually somehow don't have the aesthetic sense, because not everyone is born with that aesthetic sense. As I said, no, there can only be like one Michelangelo. Not many people are having that same kind of aesthetic sense. At least if you have the constant numbers, you can give a better approach to your patients, right? And over here, if you see, you can probably give the best result to your patient. Probably the best. You'll be like, wow, I've done such a great job. But you know what? Sometimes she might not be happy with it. Okay. And also remember, you can never ever give the same result twice. This is not because of you or your limitation. It is just the limitation of the procedure. Everyone heals differently. Okay. For example, if I have now a patient who comes with very severe laxity and she says, Doc, I want to do a laser vaginal rejuvenation, because somehow in her mind she thinks that somehow it's going to magically feel more tighter again, like how she felt before. Okay. So, but remember over here, managing her expectations, but also not dismissing her, is probably very, very, very important, because chances are somehow you do the procedure and she might actually feel different after, sorry, she might feel some difference after the treatment. So always I would say, manage her expectations, but don't dismiss her. Over communicate. There's nothing wrong. In fact, for anyone who's coming for cosmetic gynecology, like either vaginismus, hymenoplasty, labiaplasty, whatever it is, I spend at least 1 hour with them, because you need to be comfortable with them. They need to be comfortable with you. You need to understand exactly what they want. Not only that, this is also important because you can definitely identify people who have BDD. BDD is nothing but the body dysmorphic disorder. Usually in the whole population, it's only around 1%. But because you have a cosmetic unit, the people who are coming to you will be at least 10%. I had to say no to so many patients because I feared they had BDDs. I always have a huge team. I'll be talking about the team next. But what I'm trying to say is patient selection is absolutely important. The biggest difficulty you will face over here as a cosmetic gynecologist is that, you should convince the patient that you're not a magician. Okay, that's I know it's very difficult because for us gynecologists, no, we're always like superstars, right? The patient has fibroid, you know what, I can finish, I can remove the fibroid, they have endometriosis, I can clear your endometriosis. So, we're always so confident, but when it comes to these procedures, we need to, bring down both our confidence as well as also the patient's expectation. Okay. So, very early on, I realized the importance of having teamwork. Okay, because I'm an endoscopic surgeon as well. I think I've already said, no, I was one of the first people. I mean, probably the only one who has ever done a uterine rupture, like second trimester uterine rupture. I've done it laparoscopically. And being an endoscopic surgeon, I know how important it is to have a very good team, right? The same is over here as well. You need yourself, the plastic surgeon, the physiotherapist, the psychologist, and also a marketing expert. All of them together, only then you'll be able to have a good unit. Because if you treat your patient with your machine, but then you forget to give the right counseling about bladder training, you don't tell them about the bladder diary, you don't give them the pelvic physio or the psychological counseling that they require, whatever treatment you do is not going to last forever because only the machine is going to help for a little bit amount of time. They're not going to have the lasting effects of the lasting effects of what you're looking for. Okay, so but when if it's a team approach, okay, patients also are more confident. Okay, the communication in between the consultants also will boost the outcome. Not only that, also the patient satisfaction also is improved during this period of time. Okay, so 1 second. Yeah. So, see, all of us here today are in the process of mastering this art. Okay. None of the techniques are final. Today, you'll see one technique for labiaplasty. Tomorrow, you will see something else. Right. Understanding when to treat and when not to treat only, we have to understand. Because I still remember how my techniques, previous years and all have evolved. I used to see so many other people doing their procedures. I used to take some from here, some from there, and simple processes like hymenoplasty also, what I used to do before, it has completely changed right now. Most of the so-called experts, in cosmetic gynecology are also just beginners. It's just that probably they would have started off earlier, but you know what? We are all very new to this. Most non-surgical techniques like, your Botox, PRPs, fillers probably will take you 1 day to understand. Okay, something like liposuction or fat filling probably takes a little bit more time. It has a learning curve to it. Like labiaplasty, vaginoplasty also has a longer, learning curve. So it's always better to know all the kinds of techniques which are available. Probably see some of the techniques of the foreigner. I mean, the people who are the, like Dr. Red Allen Sword, or you can see some of Dr. Bader's techniques. Learn from everybody before you take the scalpel. That is very, very, very important. Just by doing one course, don't go back and start taking the scalpel and doing it. If you want to do it also, get somebody who has been doing this before so as to you can learn from them as well. Because you make a mistake in the first time and there's some problem which comes to the patient, it's going to, ruin your experience as well as the patient's experience as well. Okay. Some other procedures like abdominoplasty, breast augmentation take much more longer time. It also requires a lot of skill. So always, as I think Dr. Tanuja said, you need to involve your plastic team as well. Don't try to be a hero. Don't try to do everything by yourself. Even for my labioplastics, I call my plastic surgeon because you know what? They will give you some techniques. They will tell you some ideas on how you have to do. So an expert is someone who has learned all the techniques and makes their own modification, and they hybridize and combine treatments for better outcome for the patients, right? So I hope I was able to impart some value today. Because how this field grows is actually completely in our hands. Okay, we are all the pioneers, we are the innovators. We either make it or we break it. So I want to leave you with this quote. Let's together add life to her years and not years to her life. Thank you so much.
Yeah, wonderful, Surakshit. Superb talk. It was really practical and a crystal clear for
Thank you.
everyone out here. A very important message is that you have to be very careful, teamwork and everything. So I think the cosmetic and aesthetic health of women is Surakshit here. So thank you so much. It was wonderful.
Thank you, ma'am. Thank you.
Yeah, thank you, Surakshit. I'm echoing the same words as what Varsha said. I'm sure the patients are going to be very Surakshit with you. There are just 2-3 things which really struck me. Number one, these are not patients, these are clients. What a statement. Number two, this is not an obstetric unit. This is not a corporate hospital. They want small, cozy places where they get their privacy. And this is a place where you may not be known, because they want a good procedure and a good result. So they will Google you out and then they will come to you. This is not like an obstetric unit that, the mother-in-law and the mother and the relatives are involved and say, nahi, nahi, delivery isi ke paas karna hai. This is not like that. What I'm also
Yes.
realizing that this is completely a developing field. And maybe in the next 10 years, all of you are going to be icons in this field, because you may probably develop your own procedures, develop your own modalities of treatment, and give the best to your patients. So nice. What a wonderful lecture, Surakshit. Wonderful.
Thank you so much, Dr. Raju. Thank you so much.
Yeah.
So thank
Now,
you, Dr. Surakshit. It was a very stimulating talk. And what I truly appreciate is you were very vocal, very frank, and we got some real-time, genuine insights from you. So that is truly appreciated. And last but not the least, thank you for instantly and humbly accepting the invitation. Thank you so much.
It's my pleasure. Thank you so much, Dr. Janvi. Thank you.